Hello and welcome to this brief presentation on ketamine. This training has been designed to familiarize Michigan Southeast Region paramedics with the administration of ketamine when indicated by protocol. This training applies to all paramedics that provide care in any of the Southeast Region medical control authorities. By the conclusion of this brief presentation, you will be able to identify the location of ketamine in the Southeast Michigan drug box, as well as how it may be packaged, describe the pharmacokinetics and pharmacodynamics of ketamine, list the indications and contraindications of ketamine, and finally, describe how to administer ketamine, as well as list the applicable medication concentration, routes, and doses per the applicable state EMS protocols. As of June 1, 2018, ketamine is one of 4 new drugs that have been added to the Southeast Michigan regional protocols. Ketamine is a versatile medication with diverse therapeutic benefits that has several applications within the state protocols. Ketamine offers another alternative to opioids when treating significant pain. It also has the ability to potentiate opiate medications, potentially providing more effective pain management in cases of severe pain. In addition, it acts as a potent sedative agent for painful pre-hospital medical procedures and serves as an effective drug for chemical patient restraint when indicated. It is important to understand that there is currently a national shortage of ketamine, and it will not be stocked in the southeastern Michigan drug boxes by June 1, 2018. All LSAs will be notified when there is no longer a shortage of ketamine. In addition, details will be provided by your medical control authority regarding when it will be stocked in the drug boxes, which may be several months later. Once it becomes available, one 10 milliliter vial of ketamine containing 1,000 milligrams will be located here, with the other controlled substances on the middle shelf of the drug box. Like the other controlled substances, ketamine will not be located in the APACs. Ketamine is an NMDA receptor antagonist, which means it prevents the brain's most prevalent excitatory neurotransmitter, glutamate, from activating these receptors. At low doses, ketamine is a very effective analgesic medication. At higher doses, ketamine produces a state of dissociative anesthesia, making it an effective medication for patient sedation and chemical restraint when indicated. Ketamine may be given by various routes of administration. Assure you are using the correct route based on the applicable protocol. Ketamine's onset and duration of action varies depending on the route of administration. When given IV or IO, the onset of action is 30 seconds, with the duration of 10 to 15 minutes. If given intramuscular, the onset is slightly longer at 3 to 4 minutes, with the duration of 20 to 30 minutes. And if given intranasally, the onset is 2 minutes, with a duration of action of 20 to 30 minutes. Side effects of ketamine include an increased blood pressure and heart rate, and in rare cases, when higher doses of ketamine are administered, patients can experience a condition known as an emergence reaction, resulting in hallucinations and nightmares as the patient recovers from ketamine's dissociative anesthetic effects. Ketamine is indicated in the following procedural and treatment protocols: pain management, excited delirium, patient restraint, and patient sedation. Ketamine should not be administered to patients who have an allergic reaction to the drug. Ketamine is a very effective analgesic medication. For adult and pediatric patients experiencing significant pain greater than 4 on the Wong pain scale, consider it for analgesia. Keep in mind, patients complaining of severe pain, rated greater than 8 on the Wong pain scale, may receive opioid pain medication first without the need to obtain online medical direction. However, per the pain management protocol, obtain online medical direction when considering an opioid medication for pain relief after ketamine has failed to adequately reduce the patient's pain. Ketamine is also an effective treatment for excited delirium. Per the excited delirium protocol, if a patient remains combative after physical restraint, administer 10 milligrams of midazolam intramuscularly or 5 milligrams intranasally. If the patient remains combative 5 minutes after midazolam administration, administer ketamine 4 milligrams per kilogram intramuscularly. For ill or injured patients who endanger themselves or others, ketamine can be used as an effective means of chemical patient restraint. Once physically restrained, if a patient continues to fight against their restraints, chemical restraint should be considered. Initially, administer midazolam 10 mg intramuscular or 5 mg intranasally to chemically restrain a patient when indicated. If midazolam fails to adequately reduce the patient's combativeness, administer 4 mg per kilogram of ketamine intramuscularly. Prior to performing a painful medical procedure, patient sedation may be considered per the patient sedation protocol. Only one medication may be given pre-radio for patient sedation. If a second sedation medication is needed, medical control must be contacted. An initial dose of ketamine 4 mg per kilogram intramuscular or 1 to 2 mg per kilogram IV, IO, or intranasally may be given for adult and pediatric patient sedation. To administer ketamine, first, remove the vial of ketamine from its container, located in the controlled substances compartment of the drug box on the middle shelf. Assure you do not confuse ketamine with ketorolac, which is also located on the middle shelf in the center compartment with the ipratropium bromide. Next, verify the correct medication and dose. Within the Southeast Michigan drug box, ketamine is supplied in a concentration of 1,000 milligrams in 10 milliliters, or 100 milligrams per milliliter. Next, draw up the medication from the vial. The correct dose is dependent upon the applicable protocol and the route of administration. Prior to IV or IO administration, dilute the volume of ketamine with equal parts of normal saline. Also, administer ketamine IV-IO slowly. For pain management in adults, or for patients weighing greater than 80 kilograms, administer 0.2 milligrams per kilogram with a maximum single dose of 25 milligrams. You may give a repeat dose once, after 10 minutes, to a max total of 50 milligrams. For pediatric patients or patients weighing less than 80 kilograms, administer 0.2 milligrams per kilogram with a maximum single dose of 25 milligrams. You may give a repeat dose once, after 10 minutes, to a max total dose of 0.4 milligrams per kilogram. For patient sedation in adult and pediatric patients, administer 1 to 2 milligrams per kilogram IV or IO slowly. Remember, you must obtain online medical direction for repeat doses or to administer additional sedation medications. IM administration of ketamine is permitted in the excited delirium, patient restraint, and patient sedation protocols. Per the excited delirium and patient restraint protocols, midazolam is the initial treatment. Remember, if midazolam fails to adequately calm the patient after 5 minutes, administer ketamine 4 milligrams per kilogram intramuscularly. The use of ketamine in these protocols is not approved for pediatric patients. For adult and pediatric patient sedation, administer ketamine 4 milligrams per kilogram intramuscularly. Again, you must obtain online medical direction for repeat doses or to administer additional sedation medications. When administering ketamine intranasally, rapidly depress the plunger of the syringe. Administer 1/2 the medication in each nostril. The maximum volume per nostril is 1 cc. Intranasal ketamine administration for adult patients, per the pain management protocol, is 0.5 milligrams per kilogram, with a max single dose of 25 milligrams. A single repeat dose may be given to a max total of 50 milligrams. For pediatric patients, administer 0.5 milligrams per kilogram intranasally, with a max single dose of 25 milligrams. A single repeat dose may be given after 10 minutes to a max total of 1 milligram per kilogram. Per the patient sedation protocol, for adult and pediatric patients, administer ketamine 1 to 2 milligrams per kilogram intranasally. Again, you must obtain online medical direction for repeat doses or to administer additional sedation medications. All medications located in the Southeast Michigan Drug Box and APAC are described in Section 9 of the state protocols. In Section 929, you'll find information is provided regarding ketamine, which includes a list of all applicable protocols, indications, contraindications, dosing, expected effects, and side effects. Finally, it's important to know that the MyMedic cards have been updated to include ketamine. Contact your EMS coordinator to obtain a copy of the updated version of the MyMedic. This concludes our brief presentation on ketamine for Michigan Southeast Region paramedics. Contact your EMS coordinator or medical control authority with any questions regarding the information presented in this training. Have a great day.